Hello, my name is Hayley Miller. I'm one of the first-year maternal fetal medicine fellows. I will be presenting cervical insufficiency, cerclage, and early preterm birth, differences among racial and ethnic subgroups. My co-authors include Dr. Suharwardy, Leonard, Gerson, and Lyle. Our study sought to assess rates of cervical insufficiency, cerclage, and early preterm birth among racial and ethnic subgroups within a large, diverse cohort. This was a retrospective cohort study in California during 2007 through 2012. Rates of cervical insufficiency were compared between white patients as a reference group and Asian Indian, Black, East Asian, Latin American, Caribbean, Mexican, Native American, Southeast Asian, Pacific Islander, or multi-race and other patients. We estimated racial and ethnic differences in cerclage placement in early preterm birth among patients with cervical insufficiency. Our study showed that cervical insufficiency was highest in Black and Asian Indian patients and lowest in East Asian patients compared to white patients. Among patients with cervical insufficiency, rates of cerclage were highest among Black and Asian Indian patients and lowest among East Asian patients. Southeast Asian, Pacific Islander, Latin American, Caribbean, and Black patients had higher rates of early preterm birth, which was defined as less than 34 weeks, with adjusted odds ratios between 1.3 and 1.4. In summary, in a diverse California cohort, rates of cervical insufficiency were highest among Black and Asian Indian patients. Among people with cervical insufficiency, Black and Asian Indian patients also had the highest rates of cerclage, but ultimately, Black patients had higher rates of early preterm birth. Important differences in rates of cervical insufficiency and other diseases may be detected when racial and ethnic subgroups are studied rather than traditional major racial and ethnic groups. Thank you for attending my poster session.